My name is John Kelly, and I've been using PCAs for 30 years since I became disabled at the age of 25. Without PCAs, I wouldn't be able to do anything. I never did go back home. After my injury, I was already living independently, and after I got out of the acute care rehab, I was able to move back into the community with a staff of PCAs. I received skills training from the Boston Center for Independent Living, and now for the last 28 years I have used hundreds and hundreds of usually young people helping me out with my activities of daily living. Everything from getting up in the morning, washing my body, getting me dressed, getting me into my wheelchair, and putting me to bed at night, helping me with meals, managing my home. And from the old medical perspective, I couldn't do anything myself, and in the old days I would be put into an institution and be seen as sort of a charity case. With PCAs, which for me is the bedrock of independent living, I can do anything that I can work out doing, whether it's working on activism, working on access, working against assisted suicide. My helpers get me ready for the day. They do it at the time of my choosing. I get to hire people that I want to work with. I've had to let go people, unfortunately, but the point here is that I'm in control of my life. Just because I'm not the actual task doer myself, that doesn't mean I'm not in charge. Just like any executive of any agency or company, I run the show, and I've had some really fantastic friendships develop from working with helpers, and I've had some that have worked with me for many years, and I think the program is such a success. And without the PCA program, I wouldn't be able to live in the community, I wouldn't be able to make a difference, I'd be a drain on society, and I would be miserable. With them, I can lead a happy, dynamic life, and wouldn't trade the PCA system for anything. When I was first disabled, I really didn't know how to cook except for a couple of dishes, and for a number of years I didn't bother learning how to cook. But say in the last 20 years, I've worked with a succession of PCAs who were interested in cooking, and I've learned a repertoire of recipes that I teach to new helpers, and my helpers have taught me some tricks that I've been able to pass along, and just to be able to develop new skills with people and to learn from another person. From my experience, when I'm working with a PCA, it's more like we're co-workers than it's a caregiver working to take care of me. We're working together on an issue, whether it's taking care of my skin that might get injured or making sure I'm sitting correctly in the chair. We're on the same side. It's not an adversarial relationship. I have learned so much from my PCAs. When I was quite a bit younger, I was a bit of a perfectionist. If things didn't go perfectly well, I would get very frustrated. And I've had an assistant for off and on the last 10 years. He comes from Barbados. He comes from a culture where things are not expected to go perfectly every time. And he's taught me some sayings that have really helped me in my life, such as every day not Christmas. Things don't go well and perfectly every single day. We need to expect that things will go wrong. Expecting things to go perfectly is a setup for being miserable. Another phrase he's taught me is no kill cow, as in if something goes amiss or astray, it's not that big a deal. You don't need to kill a cow over it. And then there's if you can't do something one way, you can do it another. which is if you can't ride a horse, you ride a cow, and which means whatever way you can do it that way. And that's something that, as a person with a disability, we're always exploring new ways to do things and trying to be creative. And my helpers have let me relax and grow into myself a bit, and not worry so much about the little things, where something might be left in the apartment, or one gets a little bit of a easier approach to the small details of life, and you can concentrate more on the big picture. I've also learned from an African fellow who told me that, from where he comes from, it wouldn't be a demeaning position to work for me, as some people want a PCA job to be because it's working with other people, but it would be an honor because he is the person that was the bridge between my not being able to do anything to my being a functional, competent, effective person in the world. So he could really see the difference that he makes. I've had lots of helpers with lots of great ideas, and we've made tools for me to stir garlic and onions in a pan, to using a pen, getting water, getting pills, or a sandwich even. And so we have this sort of spirit of discovery and creativity that really can make life fun, frankly. Ta-da! One of the things that using PCAs has enabled me to do is travel. I've been to California, Florida, Tennessee, Canada, Chicago. I've been to academic conferences. I've been to actions around the country, and that is possible because I formed a relationship with a PCA and traveled with them either by airplane or by car, and it can be really a gratifying experience that would be completely impossible if I were tied to an institution or to a home health care agency. Having PCAs gives me the freedom of movement and action that an able-bodied person has who doesn't need to have someone help them with their bodily care. Those sayings are hilarious, aren't they? Every day, not Christmas. Yeah. Yeah, I'd be like, oh man, this is taking too long. He'd be like, oh, every day, not Christmas.